We are joined this morning. Of course, it is that time of the month on this Friday morning. We are naturally speaking with our great friend Kelli Kieselbach, who is with us this morning. How you doing, Kelli?
Yeah, I'm doing really well, thank you. How about yourself?
I'm going well. Nice to see your face this morning and have you on the line with us. And look, another big topic today. And initially, we're going to have it as a one-word title, but we can't really do that this morning because it's kind of a very broad topic. This one, we're looking this morning at reflux, indigestion, and bloating. So
Yes.
something that affects a lot of people, doesn't it?
It does affect a lot of people, and these are like the little niggly things that often people will just put up with, or, just be relying on sort of medications and things for. But there's actually quite a bit that we can do for this, and it's our body trying to tell us something's not quite right. So it's important to pay attention to the little niggly things sometimes.
Yeah, absolutely. So I guess the best way to get into it is, exactly what is that? Like, what is going on in the system?
So when we talk about reflux, indigestion, and bloating, they all involve sort of that upper digestion. So we're looking at what's happening in the stomach predominantly, and sort of that upper, small intestine. So when we talk about reflux, that's a bit more specific. So this encompasses, that you get that burning in the chest, sometimes regurgitation, sometimes a chronic cough or difficulty swallowing. And you can also have silent reflux where people don't get any symptoms at all. But, it's to do with that stomach acid when it sort of splashes back up into the esophagus and causes some inflammation. When we talk about indigestion, that's a bit more of a general term for just unhappy upper digestion. So you get a bit bloated, you might get some nausea, get that sensation of food sitting in your stomach for a long period, sitting heavy in your stomach. And so just that general discomfort. But yeah, it's all to do with, what's happening in that stomach upper digestion area.
Yeah, so what are some of the causes that you could probably look at with that and even risk factors involved?
Yeah, of course. So people do tend to be more at risk, particularly when they are maybe pregnant or overweight. And this is more to do with some of those structural changes. So, not as much room in there. But when we talk about reflux, that's specifically to do with the weakening of the lower esophageal sphincter. So this is the little sphincter that is supposed to stop the stomach acid from splashing up into the esophagus. But there could also be, often stomach acid gets a bad rap for this. And historically, we've, talked about it as too much acid, where now we know that that's not necessarily the case, but it's more of a dysfunction of how that acid it's being displaced basically. And it can even be a result of having too little stomach acid, which causes food to sort of sit in the stomach for long periods of time, and you're just not digesting things properly as well. So definitely, pregnancy, being overweight, age, but lifestyle has a huge impact. So if you're particularly stressed, if you're eating the wrong types of foods, we've talked a lot in the past about our microbiome, so our gut bugs, they can also play a role here as well. So the causes or risk factors are sort of multifactorial and can get quite complex.
Yeah, absolutely. And again, we sort of look at a few of these broader terms, heartburn, acid reflux, GERD is what they call GERD. Is there a difference between those kind of things?
Yeah, well, so indigestion is more, as we said before, that general term. So it's just saying, when there is, I guess, as the name would suggest, there's a reduced capacity to be able to digest properly, and you end up with discomfort, stomach pain, bloating, etc. GERD is the medical term for a more chronic reflux disease. So it stands where you're getting that stomach acid splashing up in the esophagus, and it's causing inflammation, and long term that can create more damage. So GERD is the more serious chronic term for ongoing reflux.
Yeah. So I guess the next question is, what can we, are there certain foods that we should be avoiding, if you're kind of more prone to these things? What are some of the recommendations around that?
There are definitely some common triggers that you might want to be aware of. It is important to understand that it can be quite individual. So we might talk about common triggers and someone might go, oh, I don't react to any of those foods, but they might have some particular food that doesn't agree with them. So it's important to understand there is a lot of individuality, but the common triggers are certainly alcohol, dairy is a big one, spicy food is a big one, tomatoes, chocolate and coffee. They're probably the big guns that commonly come up. It is important to understand, though, that it's not the food itself that's necessarily causing the issues. It's the triggers. So avoiding the triggers can help with managing the symptoms, but it doesn't really fix the underlying cause.
Yes, I think you just mentioned coffee, chocolate and tomatoes.
Yeah.
There's three of my favourite things gone out the window already.
Okay.
But that's fine. Look, I don't really, thankfully, I don't really suffer from any of that. Just it's maybe once in a blue moon. And I think most people are probably in that boat too, aren't they? Maybe once in a blue moon. Some people don't. Are very fortunate enough they don't have that at all. But other people.
And the occasional bloating, the occasional episode of indigestion, that could be normal if you've overeaten or, had a big Easter weekend with the chocolates. But if it's happening on a regular basis, then it's telling you that, okay, things aren't so happy down there and we might want to address that.
Yeah, absolutely. We are chatting with our great friend Kelli Kieselbach this morning, naturally speaking, looking at a fairly big topic here this morning, reflux, indigestion, bloating. And if you want to get some more info on that, make sure you stay with us. We'll take a short break. We'll be back with Kelli right after this. It's Rhema Brekky on your Friday morning. Great track, that one, Zach Williams, Chain Breaker, 20 minutes after 8. And, of course, we are naturally speaking on this Friday morning with our great friend Kelli Kieselbach, a naturopath and nutritionist. And we are looking at a fairly big one today, reflux, indigestion, bloating, all the lovely things of life after you get those big meals at times. And it's not fun for a lot of people out there. Now, we've already been having a look at a few things, Kelli, but I wanted to look at some of the ways that we may be able to alleviate some of those symptoms around this.
Yeah, absolutely. So I think it's important to recognize that even though there may be foods that trigger, it's not just all about what we're eating, it's about how we eat. So the habits around how we eat actually play a big part in how well we digest our food and how we can manage some of these symptoms. So making sure that we slow down, chew our food, try and eat in a relaxed environment, in a calm environment. These things are actually really, really important, and they can make the world of difference to someone who's experiencing bloating, indigestion, reflux, all of those things. So that's number one. Watch your habits, watch your, how fast you're eating. Don't scoff your food down. The other thing is, I love using herbal teas. So there's a bunch of, my favorites for digestion would be fennel, ginger, chamomile, and licorice. But these herbs can be easily accessible in a tea form, and they can help just improve that digestion and improve some of those symptoms and settle everything down as well. And the other important thing is to manage stress, because stress has a really big part to play in shutting down our digestion, or not completely shutting it down, but inhibiting how well we're going to digest and how well we produce stomach acid and how well we produce enzymes and how everything's moving through. So really trying to do things to manage stress will have that flow-on effect to help us manage the symptoms as well.
Yeah, it's amazing, isn't it? Just how much stress does affect the body in so many different areas. Often we think it's, absolutely, a mental thing, which obviously it is, but the way that it affects your body, and obviously a lot of research being done now, they're looking at all the cardiovascular effects of stress, but just even something like eating food and trying to enjoy a meal, and then next thing you know, you've got all these digestion issues going on with that. So it is a huge one right across the board, isn't it? Stress.
Absolutely. It's systemic and it is a physiological reaction. And sometimes we forget that as well. So it's going to have an impact on our digestion, our immune system, our everything, really.
Now, I know with people, obviously with eating around meal times and things like that, would it be better off with the teas or the water? Which would you probably prefer around that area?
Look, it depends on the person. So a little bit of water is fine. Typically, we don't want people drinking huge amounts of liquid around their mealtime because we don't want to dilute that acid. That stomach acid is actually very, very important and crucial to breaking down your food properly and making sure that we don't get some of those symptoms. So, I like the herbal teas sort of after a meal to help everything move through. So long as we're not having huge amounts of liquid around the mealtime, but a little bit's okay.
Yep. Good thinking, that one. Now, look, with something we should touch on this morning as well, and that's to do with, medications that people might be taking, particularly if it's long-term, and how that can affect the whole issue of indigestion and reflux and bloating. What are some of the things we should be on the lookout there for?
Yeah, so I mean, reflux medications are, becoming one of the most commonly prescribed medications. So I think it's just really important to understand that what these medications are doing is they're working to suppress your stomach acid so that you don't get that splash up into the esophagus, and that can help with the symptoms. However, they are not designed as a long-term fix. They are for short-term to help with symptom management. And we know now that there are a lot of negative long-term health outcomes if people are on these for many months or many years. So the more that we can do to fix the underlying causes and help people to reduce their need for those medications, the better it's going to be for their whole health. So fine for, short-term use, but really important that we find other ways as well to manage what's going on.
Yeah. And I guess on the back of that too, one of the other things that was always common back in the day was the good old quickies and the antacids and things like that. And people used to throw those down like lollies. I knew people like that. It was quite amazing.
And same thing, because, it's doing the same thing, suppressing that stomach acid. But if you don't have stomach acid, you can't digest your proteins, which means you can't absorb those amino acids to build muscle and all of that. You can't absorb lots of your minerals. So calcium, B12, iron, zinc, they all rely on your stomach acid. Your stomach acid is also so important for infection control and in your immune system. So, bugs that are on our food should be neutralized in that stomach acid. So there are so many important health benefits of having good stomach acid and good digestion, and we don't want to be impeding that long term because it's going to have some serious negative impact.
Yep, absolutely. Another one we should probably cover really quickly this morning is probably meal timing, and particularly the last meal of the day. So for us, it's usually dinner time. Most people have it around 6, 7, sometimes even a little bit later, but generally it's around that time. And some people even love to have a snack late at night. So what should you be doing there, particularly if you are somebody who does suffer from that reflux and things like that?
So ideally, we don't want to be eating too late at night, and there's a lot of reasons besides reflux for that. But trying to finish eating dinner around 7:30 is ideal. That's not practical necessarily for everyone, but if you do need to eat later at night, then making sure that you remain upright for a period of time after you've eaten, because if you lay down straight away, that could make those symptoms worse. If you feel like you're a snacker, you like to have something before bed, I would try and be sticking to things that are, trying just to have like your herbal tea or maybe have a bit of a smoothie, something that's super easy to digest, rather than having, large protein meals or lots of processed foods or those trigger foods, definitely avoiding those, and avoiding things like coffee and alcohol in the evening as well can be really important as well.
Yeah, sure. I have experienced that myself sometimes where you do have, you've had a late night, you have a quick snack and then you think, oh, look, I'll be fine. I'll go to bed now. And you wake up later on through the night and you're burning. You're like, oh, that was a very bad idea. I'll have to not do that in the future. Now, to wrap us up this morning, as a naturopath and a nutritionist, what are some of the ways that you would go about treating these kinds of issues?
Yeah. So the first thing, I guess we are looking at the body as a whole, a holistic thing. So I'm looking at what are the contributing factors? What are the food triggers? What kind of stress is in their life? Are they overweight? What's their bacteria balance like? So we're assessing all of these different things to work out what's contributing. And then I'd be doing things to, support people's digestion so they're breaking down their food properly. And this might include things like maybe using digestive enzymes or using foods or herbs that help improve those secretions. It would also be looking at supporting the balance of bacteria further down in the gut as well, because that's going to can be contributing as well. And I'm also going to be helping them with stress management techniques. So I'll often tell people with indigestion or reflux, try and do some deep breathing before your meals. Mm-hmm. So take a moment to do some deep breathing, do a little check-in to make sure you're nice and relaxed, and then make sure you're chewing your food. So some of those like lifestyle factors become really, really important. And we might, if they're very, very stressed, then we might also look at, using herbal medicines and nutrients to help with that relaxation and to help reset their nervous system a little bit as well. So they would be the key things we'd be doing. And then we'd look at other individual factors that might be, significant for that person sitting in front of us as well.
Yep. So the good thing about it is it's not a one-size-fits-all approach. It really does come down to your own physiology and your lifestyle habits and that as well, so you can tailor something for the person.
Yeah, that's right. That's what it's all about. So what's your unique health story and how can we support you for what you need in this moment and moving forward? Yeah.
Absolutely. Yep. Kelli, it's been a great pleasure talking to you this morning. As always, love these little chats that we have on these Friday mornings just to put out some of that great health advice. And look, if people want to follow you, maybe jump on, find out some of your resources, how to get in contact, things like that, how can they do that?
Yeah, so you can head to my website, which is kellik.com.au, so kellik.com.au. I'm also on Instagram, Facebook. Would love it if you wanted to join me there. So that's kellik_naturopath on Instagram. And if you search Kelli K Naturopath on Facebook, you should be able to find me. But yeah, I'd love to connect. And you can always book a free phone appointment as well if you want to just have a little bit of chat about your needs and whether you need some extra support there as well.
Yep, brilliant. Love it. And again, look, guys, follow her on social media for sure, because there's always great posts, particularly on Instagram, that Kelli is posting up there. And there's some great little info and nuggets on there, so it is a great one. Looking forward to talking to you next month, Kelli. It's always a pleasure.
Excellent. Thank you.
Stay with us. We'll be right back. This is Rhema Brekky. It is your Friday morning.